Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, February 15, 2022. Thanks so much for joining. As always, this is your opportunity to get your COVID questions answered live. I had some time off last week, which I enjoyed. I continued to follow the COVID numbers from afar, and we've really continued to see some good improvement there. So let's take a look. We've gotten a lot of questions in about numbers and mask requirements, etc. So I've got some data to show there. We'll start with the COVID dashboard. As always, chi.gov/COVID-dash. You can put questions for me directly into the box below or use the hashtag AskDrArwady on either Facebook or Twitter. So when we pull up the dashboard, we're seeing a lot of green, a lot of good news here. You see our daily case average is down to 431 cases per day, down 30% from a week ago. And a number of you, almost every day still, continue to write in asking about positivity and cases and how they fit together. So let's talk about that. Cases are down 30% from a week ago, whereas tests performed are up 17% from a week ago. So if the outbreak were flat, these would be the same. Tests would be up 17%, cases would be up 17%. The fact that we see cases drop while tests performed goes up lets us know it is a real decline. And in that setting, we have also seen the positivity then. Remember, that's just the percent of positive tests, the number of positive tests divided into all the tests that are done, deduplicated, and that we are at 2% now, down from 3.3%. The hospitalizations here represent new hospitalizations per day. So we've still got about 30 Chicagoans every day getting newly hospitalized with COVID, but that is down about more than 50% from a week ago, and making good progress. And deaths are back down to averaging under 10, which is good. It's still, all of these numbers remain higher than where they were prior to Omicron, but continuing to drop really quickly. Vaccinations, we're still doing about 6,400 a day. And I'll show you some more data on that in a second. Generally the news looks good. We've got some folks here, Ryan Ray on Facebook was asking what's the positivity rate in Chicago. This is the positivity rate for all of Chicago right here that you pull it up. And then if you want to go under tests, you can break it down by neighborhood and other demographics. And then he's asking what percentage of people got vaccinated. So on the home dashboard here, this is for all ages in Chicago. 68% of all Chicagoans, all ages, have completed the vaccination series, and 76% have gotten at least one dose. And you can click here, just as a reminder on vaccines, if you want to see some more details. So like the percent vaccinated over time, if you hover over this, it'll show you since last week, we saw about a 0.5% increase, which is where we've been, continues to see, thousands more people every single week getting that first dose of vaccine, and what the percentages are. And then if you want to break it down more individually by age, you can go to percent vaccinated here, continue to explore. You want to look by race, ethnicity. So let's pull up some data here. Let me go to the slideshow to hit some of the questions that you have. So a number of people are asking, how is Chicago doing compared to the rest of Illinois or to the rest of the country? And so first of all, this is broadly how we're doing in Illinois compared to the rest of the country. You can see that really this Kentucky, West Virginia, Tennessee is the area that is having the most trouble from a COVID perspective in terms of cases per 100,000 right now. Nearly this whole map was dark purple just a few weeks ago. And if you look, Illinois overall is doing better than the country. We're seeing a light means lower, on the top here, lower number of daily cases. You can see New York, New Jersey, Maryland, et cetera, all doing much better. Ohio, and then if we zoom in with this yellow box here on Chicago, you can see that we're doing well compared to the rest of the state. So nationally, we're averaging 47 cases per 100,000 population per day. Reminder, we want that below 15 ideally, per the CDC lower risk cutoff, et cetera. Illinois is under the national average at 34, and then Chicago is at about half of the Illinois average, getting very close to that 15 mark. And 15 cases per 100,000 people translates into 400 cases per day. So that's why you can see where we're averaging 431 cases right now. That's why we're still in high transmission, but decreasing. I expect that these cases per day are going to move into substantial transmission, possibly in the next day or two, which will be really good news because we'll be out of the high transmission risk as noted by CDC. As a reminder, we want to get all 4 of these metrics down to the lower transmission setting, and we need 3 of the 4 to be there to be able to be lifting mask requirements, vaccination requirements, et cetera. So we've got lots of people asking about this. Deanna Coase, Becca Wood, Erin Elizabeth, Bizzle Scott 2, Coops. These are Twitter and Facebook names, asking about this. So I pulled here just a little bit of where we are now compared to how we've seen our numbers move across this risk matrix. So right now, cases remain in high transmission, but very close to substantial. We've seen test positivity get all the way to lower transmission first. Hospital beds, this is the 7-day average. We've got 376 people with COVID in non-ICU beds, another 115 in ICU beds. Again, this is the 7-day average, so I do expect the ICU beds to drop into the lower range just in the next few days, and then hospital beds probably a little bit behind that. So we got to see 3 of these get to blue and stay there, and then really to be out of the higher risk per CDC would be when all 4 of these get down to either lower or low. So in comparison, we are doing beautifully. So some of you are asking, how does this compare? All of this is straight off the dashboards you can explore. But our 431 cases per day is compared to 10,000 per day, 10,009 back on December 28th. We peaked here with Omicron right around the turn of the new year. You can see our positivity at 2% is down from 20% on January 2, and our average of 376 people in the hospital is down from 1,615, all of those in the very high risk. And in fact, the hospital beds have been higher than at any prior point in COVID here in Chicago during the Omicron surge. And you can see ICU peaked around 330. So if we look 4 weeks ago, you can see 3 of the numbers were still in very high transmission here. 4 weeks ago, mid-January, we were at 2,871 cases, 11% positivity, and about 1,500 people in the hospital, whereas our ICU numbers were in orange. If we look 2 weeks ago, we were seeing some good movement here where cases were still high, but just over 800 at 875. We'd seen hospital move down from red to orange. We'd seen ICU actually move from orange to yellow, and we saw positivity move here. And so just in terms of where we were here, right now, the last day we were in very high transmission for cases was January 31st. And now just a couple weeks later, we're in high, almost going to move to substantial. Similarly, test positivity, last time we were in high was January 17th. Last day we were in orange was January 23rd. Last day we were in yellow was January 26th, and we're now already in blue there. And that's just because we are doing a lot of testing. That includes school testing, and that helps drive the positivity down. We, of course, if we see test positivity get down to green here, below 2%, then it's, if cases get from orange to yellow and positivity gets from blue to green, the green and the yellow can kind of balance each other out as blue, so that's good. And then importantly, seeing some good progress here. You can see the last day we were in orange for non-ICU was about 2 weeks ago, January 31st, and the last day we were in orange for ICU was January 18th. So making very, very nice progress, and I expect to see really hopefully over the next week or so move into that lower transmission category, and we continue to use the same matrix that we've used all along. Really, this is based on data, this is based on risk in terms of when we'll be able to be lifting mask requirements and the vaccination requirement for high risk settings. So I also have gotten a number of questions and comments here about vaccine efficacy. So BMETS 131 from Twitter says, "Hi doctor, why don't you follow the data that vaccines and masks are completely ineffective at slowing the spread of COVID?" Josh McClure on Facebook says, "Dr. Arwady, how can we describe the vaccine as effective when it doesn't prevent infection spread, hospitalization, or death?" So thanks to both of you for those questions. I really want to help people understand that there is no such thing as a 100% protective vaccine for any disease, but the vaccine is by far the most important thing. And luckily, the vaccine is effective. It is actually working beautifully, especially against severe COVID outcomes. And so, you know, this is the data from Chicago. During the Omicron surge in Chicago, our age-adjusted COVID infection rates were 3 times greater in unvaccinated Chicagoans compared to vaccinated and boosted Chicagoans. I still have not had a COVID infection myself, even though I have had a couple of higher risk exposures, and that is you know, primarily due to my vaccination boosted status. But even more important than that, where we think about living with COVID becoming endemic, it becomes, can we turn this into a disease that doesn't put people in the hospital and doesn't kill them? And vaccine is by far the most important thing there too. So during the Omicron surge in Chicago, age-adjusted COVID hospitalization rates were 10 times greater in unvaccinated Chicagoans. Hospital capacity is the thing I worry about the most long term. It's why when we start getting into trouble there, it's why we have to think about vaccination requirements for higher risk settings, masks, et cetera. And then death, age-adjusted COVID death rates 30 times greater in unvaccinated Chicagoans compared to vaccinated or boosted Chicagoans. And, you know, we got some questions about, you know, what if people have previously had COVID, et cetera? It doesn't matter. This is just vaccination status, regardless of whether or not people have had COVID before. So one of the reasons we continue to really encourage people to get vaccinated, and why I'm pleased to see thousands of Chicagoans getting the vaccine every day still, is that this really is the key when you look at the data to having the best protection and turning this into a disease that we can live with. And so this is just highlighting again that 76% of all Chicagoans of all ages have now had at least 1 dose. That's great. We're almost to 77% there for our Protect Chicago 77. And 81% of eligible Chicagoans over 5 have had at least 1 dose, 73% fully vaxxed. Across the country, there's a lot of conversation around, you know, ideally sort of a 75 to 80% where you start feeling more comfortable that settings are reasonably protected, and we're making progress. But there are settings, there are schools that are well under that, for example. Here is the detail by age off the dashboard. We are approaching 50% of 5 to 11-year-olds and 80% of 12 to 17-year-olds in Chicago who have received their first dose of COVID vaccine. Really good to see. Some of this we know has been driven by travel advisories and the way schools have used that, as well as obviously protecting, it's the most important thing for protecting children and families against COVID, but also as a reminder, vaccinated children do not need to quarantine when there are cases in school, and we know that that has driven some decisions. So those are both, for both 5 to 11 and 12 to 17-year-olds, you can see well above national rates, still less than 1 in 3 U.S. Americans between 5 and 11 has had a first dose, and just 2/3 of the 12 to 17-year-olds are. And so that's part of this conversation that has gotten quite, you know, dramatic in the last few weeks around masking in schools. You know, I think some of the concern is that if we were seeing 5 to 11 and 12 to 17-year-olds across the country as vaccinated as people in their 50s and 60s are, right, 94%, this wouldn't even be a conversation. But in a setting where most children still have not had the vaccine, and we know that masking is one part of a mitigation, where there's vaccine and masking and the air filtration and the distancing, I think that's part of what's driving the conversation. We've also hit a good benchmark here. Finally, 60% of Black non-Latinx Chicagoans have had a first dose of COVID vaccine, with 54% fully vaccinated. So been working hard to hit that benchmark. Glad to see that progress. Still, though, we've very disproportionately seen Black Chicagoans be hospitalized and die from COVID, and especially related to just still some differing vaccine uptake. We've gotten some questions about how to be able to access cases, hospitalizations, and deaths in Chicago by vaccination status. Those are available now in our data portal. You can download them, and we'll be posting them graphically on our website, planning to update them weekly on Wednesday nights. So that's the direct link, but you can also get them off the top of the dashboard page where you go to Breakthrough. We've been posting the static graphs all along, but we've got the underlying data available now. So I wanted to highlight, we got a number of questions about COVID treatments, and we've been messaging this same information for a while, but I wanted to really reiterate this, because what we have seen in Chicago is quite a lot of availability of the early treatments for COVID-19, whether these are the IV or the oral medications, and not a lot of use. We've worked hard in Chicago to make sure that these are distributed equitably, to make sure that federally qualified health centers can access them, thought a lot about, where and how to make them available, done a lot of education to providers so they know where to find them, done a lot of education to patients. The challenge that we see is, first of all, that these medications, can have a lot of side effects. So a lot of the people who have the most underlying conditions sometimes are on medications that make it so they're not able to get these medications. But the biggest reasons providers tell us is that patients are still calling too late. They get infected and then they wait. And then if they start to get into trouble with COVID a week or two later, that's when they reach out. And again, we really want anybody who's got underlying conditions or is older who tests positive, please talk with your healthcare provider immediately to see if they recommend these newer treatments. These have to be prescribed by your healthcare provider. You can't go to a pharmacy or an infusion center without a prescription. And I just wanted to reiterate that everybody over the age of 65 is eligible for these treatments just by age. So certainly anybody with underlying conditions we want to call, but really anybody over 65, please give a call, talk to your doctor, because we want folks, if you do test positive, you are eligible whether or not you are vaccinated, and we'll want to make sure we're getting the uptake. All right, we got some questions about what's happening with kids under the age of 5 in vaccines. So the FDA and Pfizer, as you may have seen, delayed the authorization for COVID vaccine for kids under 5. I know that was disappointing for some of you, and I wanted to just explain why. So the FDA has said it's going to review the data for all 3 doses of the vaccine for young kids instead of starting with just the 2 doses. And why is that? The young child size trial dose is tiny. It's just 1/10 of the adult vaccine dose. So if you remember, for 5 to 11-year-olds, it's about 1/3, 0.3 of the adult dose. And with this very tiny dose, just 10% of the adult vaccine dose, they didn't see any safety concerns at all, but it was such a low dose that in the 2 to 4-year-olds, after 2 doses, they didn't really see the efficacy, the protection that they wanted. And so they're expecting after a 3rd dose to see that improved efficacy, but the decision was made to wait so that we know that when we are vaccinating kids that the vaccine is not only safe but also effective. And so I know that's disappointing. The data should be available in early April, but it does mean it's going to be a few months until vaccine is available for children under 5. Lots of availability for our family vaccine clinics this weekend. Saturday we're at Kennedy King, Sunday we're at Olive Harvey. Have seen hundreds of people continue to come out for these. We'll do boosters, we'll do kids, we'll do adults. Please come on out. Our COVID response corps is out hitting the streets again with canvassing efforts. So given that we're through some of the surge, the nice thing is these vaccine ambassadors, as part of, this is the group that started as our contact tracing corps. It's through Chicago Cook Workforce Partnership, and we have hundreds of people who can be flexible depending on what's needed. So when more contact tracing is needed, they spend more time on that. When more calls are coming into the call center, they spend time on that. When there is some availability, they go out and do some of the really important door-to-door outreach. And so we've got folks giving vaccine education and assistance, also sharing information about treatment availability, what to do if you get a positive test, helping people get connected. And we're doing that in Chatham, Auburn, Gresham, South Shore, Roseland, and Englewood. Again, just based on data where we continue to see less good outcomes. So thanks to all of them, and really shout out to the amazing outreach that continues across the city. The at-home program still going very strong. We've got availability. You can still get vaccinated at home. Anyone over the age of 5 in Chicago, we will bring you a vaccine free of charge, no insurance, no identification, pediatric, adult, and booster doses. There is $50 for first and second doses available, and we've got appointments Monday through Sunday, 8 to 6:30. So if you know anybody, the goal of this program is to remove all barriers, so you can schedule the appointment. As always, 312-746-4835 or chai.gov/COVIDVax with any questions. All right, let's turn and get into your questions. Okay. So Sarah Conley from Facebook. What should an employee do that continues to test positive after 4 weeks and their employer requires a weekly COVID test? So a couple of things here. Sarah, as you know, it is not uncommon for people to continue to test positive, especially on a PCR test. That can happen for weeks, and that's part of why the CDC, CDPH, et cetera, do not recommend that people need to keep having, that an employer should be requiring a test to return to work, et cetera. One thing, if an employer is requiring a weekly COVID test, you should make sure that that is an antigen test then, not a PCR test. Or there is some language on the website and on the CDC website that you can refer an employer to if they are trying to require or act on a weekly PCR COVID test. A positive PCR COVID test after 10 days should not still be considered positive. The person is no longer spreading COVID. You are picking up dead COVID in their nose. And so, yeah, I would refer you to our website, and we have some frequently asked questions there, or the CDC. And I hope that helps. Leslie Gray on Facebook. Why are you refusing to commit to lifting the mask mandate? When we know masks don't work, positivity is at 2%, almost everyone else has lifted mandates. It is a cold now, and this is a blatant abuse of power. So I think maybe you didn't hear what I said. I absolutely have committed to lifting the mask requirement as well as the indoor vaccination requirement when we hit the lower risk metrics, and we're close. I expect really over the next couple of weeks we're going to get there. But this is not just a cold. I wish it were. Colds do not kill double digits numbers of Chicagoans even right now. Colds do not put dozens of Chicagoans newly in the hospital every day. Colds do not threaten the healthcare system. And so as we see the healthcare, one of the reasons why we have those metrics in there for how many people are hospitalized and in the ICU with COVID is that we got to make sure that there is room to take care of whatever is needed in our healthcare system. And so I am absolutely committed to lifting that, and I think it will be soon, just as soon as we hit those metrics. So you can follow along every day to see where we are. We've been very transparent and not changed that. And I think we will be broadly in line with the timing of when others have done it. And we're doing it in a data-based way. So don't get mad at me. Get mad at people who maybe are not taking the precautions that they could right now. And on the question about masks don't work, I will tell you masks are part of a mitigation strategy that absolutely does work. Just like vaccines don't work 100% of the time, masks don't work 100% of the time. Distancing doesn't work 100% of the time. Ventilation doesn't improve or doesn't work 100% of the time. But all of these together, this is where we talk about that Swiss cheese model, right? Just as a reminder, this is a common thing that we use in healthcare and public health where we think about protecting individuals, is that if you have a block of Swiss cheese, you know how Swiss cheese has holes in it. If you cut that block of Swiss cheese up, the idea is anywhere where there is a hole, if the virus is trying to sort of get through that block of Swiss cheese, it has the potential to do it. So let's take in that first block of Swiss cheese, That's the vaccine. That's probably the most important one. But are there holes? Yeah, there are. There are some people who are not vaccinated. There are some people who are vaccinated who are still going to get infected. And so the vaccine, COVID could sort of get through that level of protection. The next level of Swiss cheese, that might be masking. And again, there are some holes there, but if you've gotten through, the holes don't always line up in Swiss cheese. So hopefully you can stop the protection there. The next level of Swiss cheese might have some holes in distancing. The next one might have in hand washing. The next one might have in ventilation. The idea is all of these mitigations together, no one does the trick. It's the mix that really decreases the risk. And for me, honestly, masking is as much like the fact that we've had almost no flu season now again is really a tribute, and so little of the cold and other symptoms that young children tend to have is just one piece of evidence that the masks do improve. Okay. So Kristen Korkowski on Facebook, is Chicago going to follow Illinois for February 28th? We may be there. We'll see. We're getting very close, and certainly I expect to continue to see improvements there. I expect that next week when we announce, we'll see where we are and be sharing that. But we are absolutely on track. That is why I showed to be hitting the data-driven requirements that we've been using all along here. Those, remember, they reflect the risk that when you are out and about in Chicago, how likely is it that you're going to be exposed to somebody who has COVID, whether or not they know it, as well as whether we have hospital protection. Yeah, and so, the criteria that we've set, again, just as a reminder, 3 out of 4 risk metrics have to hit that lower transmission risk, and we want to see them stay there. So we're close. Okay. James Booth from Twitter. You recently said you don't want to drop mitigations too soon because it could lead to another surge. Why didn't mitigations prevent a massive seasonal surge this winter? So I think the way you're thinking about this is interesting. So always when we're thinking about mitigations, the goal is to not have any mitigations, right? The goal is to have COVID in good enough control that we're not needing to have masks, that we're not needing to have vaccine requirements for high-risk settings, and then of course that we're not needing to get to a point where we're needing to shut things down, not have kids in school, all of that. And so one of the important things is when you make decisions to put mitigations in place, like a mask, like a vaccine for high-risk settings, it's because you've got to blunt sort of the surge that you're already in. There was a time, if you remember last summer, when all of our metrics were in the lower risk category, we did not have a mask requirement. We did not have a vaccine requirement. We'll be there again. But when you start to see a surge like this, particularly when it's affecting hospitalizations and deaths, the reason we didn't just move to put a vaccination requirement in place just to do it in high-risk settings. We did it because we knew that people who are unvaccinated, by and large, were driving the worst surge in hospitalizations that Chicago had ever seen from COVID-19. And making sure that people who had not chosen to get vaccinated, are not in these higher risk settings, and then potentially putting even more threat on our limited healthcare capacity. That is why we do things like that. It's not about individual rights. It's about making sure that we have the capacity available to take care of everybody, to take care of you if you get in a car accident, you need emergency medical care. And so that's kind of how those fit together. So mitigations do help in terms of protecting, but we only put them in when we see an increase. We don't put them in just for fun. And we lift them when the risk is lower. And everybody's goal, mine included, is to be in a point where we don't need to have any mitigations. And I think we're not that far away. But is that forever? I don't know, right? From Omicron, I'm very confident. I think these next few months look good. We've been watching that subvariant. It looks okay. So we're close here. But part of the decision of using using metrics and using data to lift mitigations is that at that point you've seen enough decrease that you're confident, first of all, that the risk is lower for people and that you will continue to see a decline and then hopefully can hold in a lower risk state. Adair Small from Facebook. Any recommendations for resuming singing at church or choirs or soloists? We'd love to have vocal music again when we return to in-person services. Yeah, I think it's absolutely appropriate. You know, when we are able, for example, to lift indoor masks, that is saying, first of all, like that means you can do all the things, right? We don't have any requirement right now that says you can't sing in churches, you can't sing in choirs. And we know that there have been different settings that have kind of made different decisions there based on risk. Certainly there is, when we are in a higher risk state, I do have more concern for older people or people with underlying conditions, especially knowing that singing can be a higher risk activity. And so I think certainly when you are in a higher risk setting, we've seen many places especially not do their larger church choirs, and then we've seen some, you know, use the soloist but make sure they're distanced, for example. All of that is fine, but the good news is, like, if you remember back to the last time that we were able to lift mitigations, like lifting mitigations means lifting mitigations, and I think you can be resuming the singing at church or choirs, and definitely soloists with appropriate distancing. Elaine Levy from Facebook. When can an immune-compromised person get a booster if you had 3 full doses of Moderna and are leaving the country next week? So CDC. So, all right, let's kind of talk about that. So first of all, there's immune compromised versus just regular. So for people who are not immune compromised, there is only a recommendation for 3 doses, just to be clear, okay? So if you are not immune compromised, you should get your first 2 doses of either Moderna or Pfizer, or your first dose of J&J, and then you should get a booster. You should get a 3rd dose of either Moderna or Pfizer, or you should get a 2nd dose if you had J&J. And we do recommend, if your first dose was J&J, that second one be Moderna or Pfizer, but you can get a 2nd J&J if you feel strongly about that. Immunocompromised people in particular, there have been, as you know, some different recommendations, and always I encourage you to talk to your doctor, because sometimes people have different senses of what immune compromise means. This really is for people who are moderately or severely immunocompromised, who are on medications that depress the immune system, on chemotherapy, or have a primary condition where their immune system is not very effective. And in that case, there has been a recommendation to get a booster shot, typically 5 months after the additional primary shot. So depending when your last full dose of Moderna was, you can get another one if you are immunocompromised. And I would check with your doctor about that. It really depends on the timing and how long ago you got that booster dose. Nancy Marielita from Facebook. Do you still need COVID test when traveling if you are fully vaxxed? So it depends what you mean by traveling. So in Chicago, there's, as you know, the travel advisory, which we've been updating every week. It's an advisory, it's not an order. That does not apply to people who are vaccinated. The travel advisory is meant for people who are not vaccinated. So, and as part of that advisory, that's really highlighting where in the country are we in higher risk or less high risk. Given that the whole country, you know, has remained in this higher risk status, for people who are not vaccinated, that's who we make the recommendations around traveling and quarantine. The CDC does also make some recommendations, kind of abundance of caution before or after traveling in general, to get testing, and I would refer you there. But in terms of requiring COVID testing related to traveling, most of that is if you're doing international traveling at this point. And I will tell you, and not just international, but there are some states, like if you go to Hawaii, for example, you know, you have to show proof of full vaccination. If you don't have proof of full vaccination, you then have to show negative test results, et cetera. There are a few countries that will let you show either test or vaccination. Many require vaccination full stop. And then when you're returning to the US requires a negative test regardless of vaccination status. So if you travel, first of all, bad idea to try to travel internationally if you're not fully vaccinated, because there's a patchwork of different requirements, but the great majority of countries are not interested in having you if you are not vaccinated. But let's say if you are vaccinated, there also often can be an additional testing requirement, and returning to the US, regardless of whether you're a US resident or citizen, regardless of your vaccination status, you do need to have a recent negative COVID test. And so I hope that answers your question. Mary Rodriguez from Facebook. I'm glad there are true declines. While I'll probably still wear my mask for a while, since I'm public facing and there are many people who are not yet vaccinated, are we likely to shift to a mask recommendation in higher risk settings during surges or when sick? Since masks became so politicized, unfortunately, I suppose one thing I'm looking forward to about lifting mask requirements will be to be able to assume the best in people again. Yeah, I like that comment, Mary. So a couple of comments on this. So first of all, let me just emphasize what you said in the beginning there. I'll probably still wear my mask for a while because I'm public facing with many people who are not yet vaccinated. And I want to just reinforce that that is an absolutely appropriate decision. For when mask requirements are lifted, we are going to see people for a whole host of reasons who decide to continue to wear a mask, and that is fine. We do not want people sort of fighting with each other about continuing to wear masks when the requirement is lifted. You don't know whether that person has a family member at home who is under 5 or who is immunocompromised or older. You don't know that person's health status. You don't know that person's level of risk. And so even as requirements start to be lifted, certainly there will be people who will continue to wear masks. I may continue to wear a mask myself, especially in a setting where I'm less able to distance, even as we watch the case numbers in particular come down. And are we likely to shift to a mask recommendation in higher risk settings during surges or when sick? So first of all, there will almost certainly continue to be separate mask requirements for high-risk settings. And so what does that mean? So first of all, there are federal requirements that remain in place for masking around travel, for example. So if you are taking the L, or you are taking the bus, or you are taking an airplane, or you are taking a boat, you have to still wear a mask. That's a federal requirement. It's regulated. It has to do with interstate travel, et cetera. And that is a setting where people tend to have the least control over the close interactions that they have. And so I would expect, at least for the short term, that to remain in place, probably until all of the metrics are down to that lower risk status as defined by CDC. In addition, there are higher risk settings like healthcare settings, nursing homes, where I would also expect requirements to be in place for longer. And then schools, I think, are one of the biggest questions. Certainly at the state level, Governor Pritzker and the state have said, even when we get to a point where we intend to be able, assuming that they continue to see the decrease in hospitalizations, et cetera, to be able to lift the indoor mask requirement, he was clear that for the moment that remains in place in schools. I would love to see schools be even more vaccinated. Highly vaccinated settings are not the settings I worry about from a COVID perspective. But CDC also has continued to strongly recommend for now that masks stay in place in schools, given that we've seen evidence that they decrease transmission, given that they are relatively low burden compared to other interventions, that they help keep schools open, et cetera. And there's the practical matter that with the shortened quarantine period of just 5 days, reminder, for anybody, isolated or quarantined, if you get COVID or you've had a high-risk COVID exposure, whether we're talking school, job, et cetera, remember what the requirement is. It's to stay home for 5 days and then to wear a mask for days 6 through 10. That is not going anywhere. So people will absolutely need to continue wearing a mask in that 6 to 10 day period to help limit what can be spread in that time period. And so certainly, I've been doing a lot of talking to parents and school settings, et cetera, and there's some concern that, does that have the potential to stigmatize or call out people who have recently had COVID infections? Lots of questions to be raised there, but masks will not go 100% away like that. We'll see people continue to wear them. And I do think that in higher risk settings, like I would definitely wear a mask going to see a relative in a long-term care facility. Like I would just, that for me is not a question. That is, I just know the riskiness of that setting. When I'm out and about in public, being able to drop it is something I'm looking forward to. And I do think, sort of looking ahead, I've talked a little bit, as we come off Omicron, the cases, the positivity, the hospitalization, and the ICU, those are the 4 metrics we've been following. But in a longer term way, I think as the country moves to be following this in an endemic sort of way, kind of like we do for flu. And if you didn't see this, the week before last, we did a whole Facebook about how do we follow influenza. We don't count every case, and I don't think we'll be at a point where we're counting every COVID case in the long term here. But certainly we have ways to track people coming in with influenza, not on the individual level, but broadly across emergency settings, outpatient settings. We take samples to look for variants, strains of influenza, and we, every week during flu season, we basically say the city is at a high risk, a moderate risk, a low risk, and I expect that'll be the kind of model that we will move to. And we have not, as a city, I've been really proud of the fact that since we moved into phase 5 last April, fully reopened, we have never had to do a single shutdown. We have never had to do a single capacity limitation. We have never had to do some, that sort of larger scale like we had to do early on before vaccines were available. I do not want to have to do that again. I don't think we will have to as long as the vaccines continue to work as well as they have been. I do think that we will probably, the 2 things that we have done over the last almost year, the only 2 mitigations that went in were the masking requirement in indoor settings, and then just with where we saw hospitals start to get really stretched in early January, this shorter term vaccination requirement for high risk settings. And so I think if we were to see a variant emerge in the future that really started to get us into some trouble again, we could see mitigations be coming back. They would probably, just like we did this time, we started as a recommendation. And I'm hoping that we wouldn't need a requirement or a mandate again, but if we started to really threaten our healthcare system, it is possible. It's something we could see in the future. So I can't predict the long term. My goal always is to not have mitigation, to have COVID in control, to not have the hospitals filled up, to not have COVID be one of the leading causes of death in Chicago, which it has been these last 2 years. And living with this disease means turning it into something manageable like flu. And so I agree with you. One thing I'm looking forward to about lifting mask requirements will be assuming the best in people again. Yeah, and the best in people does mean respecting people's differing risk as well as worry levels, and masks are going to be a visible sign of that. And I would ask Chicagoans to remain kind as we move into this next phase. Phase state from Facebook. Is Omicron spread by touching surfaces? So Omicron is spread in the same way that all COVID variants are spread, which is primarily by being in close proximity to living, breathing human beings, particularly if you're not wearing masks, and especially if folks are not vaccinated. There remains a low risk, very low risk of spread by touching surfaces. This is one of the things, as we learn more about COVID, I remember back the very beginning, people were sanitizing their groceries and, doing a lot of that. the risk of that is low. I don't encourage people to be going crazy with grocery washing or any of that. I do encourage people to continue to wash their hands though, because it's not the touching surfaces. As always, it's getting virus onto your hands and then touching your nose and your mouth. It's got to get into your nose and your mouth. If you remember, I used to talk about the COVID can't jump off the surface into your nose and mouth. So as opposed to being really aggressive with extra cleaning of surfaces, I would continue to encourage people to wash your hands, use hand sanitizer, and then where you are cleaning, focus on those high touch surfaces, the door handles, the places that a lot of people may be touching. And then again, if you're combining that with mask wearing and with vaccine, it's just one piece. So I hope that's reassuring. It's not impossible, but it is not the primary way at all, and not one that I certainly spend a lot of time worrying about. But I do make sure to wash my hands before I eat, and try to remember to use hand sanitizer before and after taking masks on and off. Connor from Twitter, I saw there was a dog who tested positive for COVID. Is this something we should be worried about? Okay, so yes, this is not the first dog that has tested positive for tested positive for COVID, but I believe it was the first one officially in Illinois. We had cats test positive. I want to reassure you that nothing has changed when it comes to dogs and cats related to COVID. There is no evidence that there is a high risk at all of COVID spreading from cats and dogs to humans. And where we have seen dogs in particular, get infected with COVID, they tend to have very mild symptoms, cold-like symptoms, snuffles for a dog. For me, the concern about seeing COVID, not just in dogs and cats, but in animals in general, it tells us that there's what we call an animal reservoir for COVID-19. And that means that it's one of the most important things that makes it very unlikely that we would ever completely get rid of COVID. Because as long as there are animals that are able to have it, that remains a risk. And in the same way that you can see birds have, variations on influenza, we definitely can see animals have COVID-19. But not to worry, the suggestions in terms of what to do there, we're still learning a lot about the virus, et cetera, that when possible, if you test positive for COVID-19 and you have a pet, please try to avoid close contact with your pet. Don't be, kissing and getting up close and personal with your pet while you're positive for COVID. And then if you have a COVID-19 positive animal at home, try to isolate them as much as you can for those 14 days from their positive test. Do wear a mask if you've got a pet that has tested positive. And just like a human would do, that's not the best time to be sending your pet to the groomers or the doggy daycare, et cetera. And certainly, as always, if you have a pet that you're concerned about their health, COVID or not, reach out to your veterinarian, please. And any veterinary clinics that want guidance on COVID-19 in companion animals or pets can reach out to the Chicago Department of Public Health. We will connect you with a veterinary, sort of a fellow veterinarian if you want to talk about that. So it's kind of like the surfaces. Is it possible? It's possible. Is it likely? It is not likely. And I am not worried about a huge, very serious outbreak of COVID in dogs or cats here in Chicago or in Illinois. Diane Ponder on Facebook has a follow-up. Could there be a vaccine for animals? Yeah, there could be. I think we would want to see that COVID was serious in animals and or playing a large role in sort of making humans seriously ill. One of the reasons why we have rabies vaccines, right, is that rabies is a really deadly human disease and can be a problem. We actually have seen some animals get vaccinated for COVID. Those have more often, though, been in zoo settings, so where we're talking about kind of large mammals, knowing that we've seen a whole host of animals be able to get COVID. There has been some vaccination, but there is no routine vaccination for COVID recommended at all for dogs and cats, and I don't expect that there would be one soon. Good question. Renee Harkey on Facebook, could you discuss how to move forward with social lives and mental health at this point with COVID for someone that is vaccinated and boosted? So if you are vaccinated and boosted, the news is good for you, right? you've done the most important thing to protect your individual health, and importantly, every day that the data looks better in Chicago, your risk goes down of being in touch with somebody who has COVID. And so, I certainly, everybody's going to be making their own individual decisions based on their underlying conditions, who they're in close contact with. But I would absolutely encourage people to be reemerging, to be picking up their social life with appropriate precautions. I'll tell you, I have really enjoyed being able to go back to the theater. That's something I love here in Chicago, and I've been, goodness, I don't know, 8 or 10 times just in the last couple of months. And partly that's because I know those settings require vaccination and masks, and so I know that they've done the two most important things in terms of having a lower risk, and it's something I really love. I also have been going out to restaurants. I went to a bar for the first time a few weeks ago. And I know that those are higher risk settings. Again, I know that they have had there is a vaccination requirement in place, which lowers the risk at this point, but I know they're higher risk by definition. I don't have any underlying conditions. I have plenty, as you've heard me say, I buy a lot of the over-the-counter at-home COVID tests, and I take them if I have the slightest concern or if I were going to go see an older relative, just to make sure I'm not missing anything. But I have really picked my life back up, and I would encourage, and I've worked, throughout all of COVID, like never have I worked a day from home. Like I've been working in person this whole time, as have many of my staff, and I take public transportation, I mean, you name it. And the good news is, right, as we come out, that's what we can do. For me, the mask is something that adds a little bit of extra protection, even as the levels come down. But I think it's important to be getting back to social lives and mental health. That becomes a priority just as much as physical health is. And encouraging people to continue to get vaccinated and boosted, though, too, because it's really when people are vaccinated and boosted, especially older people, that my worry about them goes down. And so if I were going to be seeing people who I knew had higher risk and were not vaccinated and boosted, that is still not something I would be feeling very comfortable with. Yeah, so Aaron Hosman from Twitter says, I'm still very curious about the travel policy, whether you're considering modifying, especially for individuals not yet old enough to be vaccinated. The application only to out-of-state travel, while in-state and city rates exceed the metric, can continue to confuse. So we actually will be sharing a little bit about that this afternoon at the press conference at 1. We are doing a regular 1 p.m. public-facing press conference and talking about this in detail. But let me just highlight a little bit. First of all, it is a travel advisory, not an order. We have found quite a lot of value in terms of people having some understanding of where COVID is surging in the country, and knowing that, for example, if you think about last summer when the Delta surge was hitting the South really hard, and we were in good shape here, that can be important information for people to have when they are deciding whether to travel. And especially if people are not vaccinated, that is important information for them to have. And so it's an advisory, it's not a requirement. Again, for people who are vaccinated, it's just an advisory. Be extra careful when you're traveling to places that are on the advisory, but you can travel without any extra requirement. But for people who are unvaccinated, it's not a great idea when risk remains high. And so certainly for individuals not yet old enough to be vaccinated, knowing that the vaccine is being delayed, we will be sharing some information about that at 1 this afternoon. But it is meant to be educational, and we know that businesses, schools, et cetera, have used that advisory. And again, it's been one layer of the mitigation strategies that have helped keep schools open and safe. But it is an advisory. It is not an order at the city level. Okay. Patty Ramirez from Facebook. How can I get my booster shot from Walgreens to be included on my COVID card from Advocate with my 2 original vaccinations? So the good news is your booster shot from Walgreens and your COVID card from Advocate are all in the same system. So if you log into the IDPH system, there's information on the CDPH website about how to do that, and download it, you'd have it all on one piece of paper. I think otherwise, if you want to bring it sounds to me like maybe you have 2 different cards, you can bring that card to either Walgreens or to Advocate or to your doctor, and they'll be happy to combine those for you onto the original card, and that's not a problem. But know that all of those are in the electronic system. Okay, we are just about coming up on time. So I see a comment here. So Athanasius Zoigenalis on Facebook, it sounds like you think I'm discriminating because I haven't answered your question, but I actually don't have any idea what you're referring to. So if you have a study or an article that you want to share, I'd love to look into it. Athanasius is writing, why are 17,000 doctors who tested the vaccine saying the vaccines are poison? They were in Washington, D.C. 3 weeks ago telling people not to get the vaccine. They said they studied them and they are poison. I can guarantee to you that there are not doctors, at least doctors that were part of studying the vaccine or part of the there are not 17,000 doctors in Washington, D.C. 3 weeks ago saying that the vaccine is poison. So I would love to see what you're reading or what you're referring to. So and then we'll address it. Just post it, and we'll look into it, and I'm happy to address it. But the vaccines are definitely not poison. The vaccines are safe. They are effective. More than 60% of people around the entire world now have had the COVID-19 vaccine without serious problems and with excellent protection, especially against severe outcomes. So please do share that so we can look into it. And then Donna Sir, this is going to be the last one on Facebook. Is an N95 mask a better choice of mask to wear when traveling on an airplane? So I would say, it doesn't have to be an N95 specifically, remember, are the ones that are meant for healthcare settings. They're the ones that have the head straps instead of the ear straps. They have the very tightest fit. Technically, they're supposed to be fitted to your face. I always say the most important mask is the one you're going to wear and the one you're going to keep on. But I would say if you have a KN95 or an N95 that you can wear and you feel is relatively comfortable, that would be the best protection for any setting, not just on an airplane. So I was on an airplane recently. I had a KN95 on, so did a lot of the people around me, and that would be my recommendation. Airplanes themselves actually have quite good air filtration, but you are in close proximity to people and you don't know their vaccination status or their COVID status. So it's a good setting to be extra careful. Okay, we are gonna have to finish up here just on time. I think I am gonna maybe just one more here, though, because Kathleen Russell Bickhouse on Facebook is saying, how much money do schools get from the state or the county for continuing testing? How many people do they have to test to get the money? So that's not how this is set up. So the federal government made funds available to all schools in the U.S. to set up testing. It's not like you get reimbursed on a per test basis or anything like that. So I can tell you here in Chicago, CDPH, for example, worked with the Archdiocese, a lot of the private schools, et cetera, helped set up systems there that they continue to have availability in CPS. They've set up systems there. There's testing available in all schools, but it's not like schools make extra money if they test more, anything like that. It was a bulk allotment back, goodness, last summer probably, to ensure that these things could be in place. And there is plenty of availability for testing in schools, and actually CPS is doing the most testing it's ever done. So I've been happy to see that. And that was in the range of millions of dollars that the schools were getting, but it was all to set up and then continue testing programs. It's not like you get the money and you can use it for other things if you don't use it for testing. Okay. We will be back on Thursday with more updates. I still see a fair number of you wondering about arbitrary, outdated benchmarks, et cetera. I want to be really clear. These are neither arbitrary nor outdated. They are very much in line with what many other cities, the CDC, et cetera, are using, and we're really close. So keep watching and keep following the numbers. You'll see right with us when we're at a point. And you know, a little bit of patience here does help protect the progress. We've made excellent progress here in Chicago. And my goal, your goal, everybody's goal is to get past COVID, right? Get back to a point where you don't have to worry about it. And so ensuring that we hit the benchmarks, which we have, which continue to be the ones that tell us what the healthcare system can handle without a challenge, that reflect you know, cases and positivity, that the risk when you're out and about is at a manageable, not a zero level, it's never going to be a zero level, but something that we can live with. Those are what those are based on, and those have been developed by epidemiologists. Nobody's making them up. They are consistent and based on risk levels, and we're close. We are doing a update at 1 o'clock today, so feel free to tune in if you are interested in hearing a little more. And if not, we'll be back on Thursday. I don't think we have a guest plan for this week, but next Tuesday we are planning to have Dr. Erica Taylor, one of the medical directors at the Chicago Department of Public Health, in talking a little bit more with me. So more to come. If we didn't get to your question, come back on Thursday and we'll try to get there. Thanks so much. See you soon. Bye-bye.